When it comes to surgery these days, the old saying, less is more, seems to be appropriate. Minimally invasive surgery means less pain, less scarring, and a quicker recovery time. Tonight, we take a look at hip replacement surgery, and while less may be more, one thing there is a lot more of is activity for the patient once all of the pain is gone.
Life is blooming again for Lee Schmitz since hip replacement surgeries has her moving around better and pain-free.
Well, back when I first was told that I had arthritis in both hips, and the left one was really bad, the pain was just dire. It was there night and day, and I finally got some pills to take for it, but that didn't do a whole lot of good.
About 300,000 hip replacement operations are performed in the U.S. each year. New technology and advances in surgical techniques have greatly reduced the risks involved with hip replacements.
Hip replacement is designed for people that have a worn-out hip. It can be from an injury, it can be from a childhood problem, or it can be from old age. Hi, Ms. Schmitz.
Good morning, doctor.
How are you?
I'm doing great.
People wonder when they should have hip replacement, and they should have hip replacement when their life is really compromised. Well, I know that for you, dancing was a prominent issue for you, and you couldn't dance before the surgery, and that was quite distressing to you.
Yes.
Can you dance now?
We can. My husband has always been a great dancer, and me too, and we love to dance, and we can do that again.
To help patients get back into the swing of things, Dr. Lester uses mini-incision hip replacement, a procedure he invented.
A standard hip replacement requires a 12 to 15-inch incision. My hip replacement requires a 2 to 4-inch incision. The surgical time is also different. It takes only about a half an hour to do a hip replacement through a mini-incision and about 2 hours to do a hip replacement through a regular incision.
After having both hips replaced with the mini-incision procedure, Lee Schmitz is back to an active life.
If it had to be, I would not fail to come back and have it done again because it gave me mobility and I felt like I'm in control of my life again. The first one I went in on the 1st of July and went home on the 4th of July, and that was a bang. And the second one I went in on Wednesday, went home on Saturday the same.
Lee also says a social clinic that meets at Dr. Lester's office once a month was helpful to learn more about his procedure for hip replacement.
It's beginning to be more and more crowded because word is getting around. Come and talk with the ones that have been there and seen and did, and it's very delightful. Everybody has a good time, and they ask a lot of questions.
Many people have been advised by their physicians to wait as long as they can to have a hip replacement, although there is no real line. The line is determined by the patient's own level of dignity, and I think that all people should choose dignity all of the time. There is always a risk-benefit ratio that needs to be understood and explained, but few people really understand how rare the risks are and how wonderful the benefits are.
Some of the most common risks are dislocation of the joint, infection in the joint, loosening of the joint, or blood clots, which are a risk of any surgery. Dr. Lester believes his patients benefit using mini-incision hip replacement compared to other procedures.
The results are remarkably different with regard to blood loss, recovery time, surgical complications, and time in hospital.
Before her surgery, Lee walked with a cane and took pain medication. Today, she uses neither pain pills nor walking aids.
And I told Dr. Lester it must be very gratifying to have seen me hobble in and walk out.
That her musculature is much better. Her whole life is better. She even dances now where she couldn't dance before.
Life is smelling much sweeter for Lee now that she can move without pain.
I walk, I dance, I vacuum, I do all the chores, and I can put on my own shoes and socks again, even if it's tie shoes.
Lee is a great example of how you don't have to live with the pain and give up what you love to do. For more information about mini-incision hip replacement, log on to our website. It's medwatchtoday.com.